Going to, obviously be a significant investment.
On the same day, the CDC confirmed the 15th U.S. coronavirus case. I went inside the agency's Emergency Operations Center with Director Dr. Robert Redfield.
How good is the public health infrastructure at reporting in?
To give you an idea of how rapidly the situation is changing.
By the way, the numbers changed. I can tell you that it's actually 15 there.
It's a lot to keep up with.
What is the worst case scenario here in the United States?
So far, we've been able to contain it, but I think this virus is probably with us beyond this season or beyond this year, and I think eventually the virus will find a foothold and we will get community-based transmission, and you can start to think of it in a sense like seasonal flu. The only difference is we don't understand this virus.
Which is exactly why the CDC wants to be on the ground in China. It's probably Redfield's biggest frustration.
Right now, there's no evidence to me that this outbreak is at all under control. It's definitely not controlled, and the sooner we can help them get it under control, the better for the whole world.
So I guess that does raise the question, why are we sitting here in Atlanta talking about this versus the CDC being in China collecting some of this data?
I don't think it's a medical decision that we're not being invited in.
What do you think it is?
Well, I think it's above the medical.
You think it's a political decision?
I think it's above the medical. I don't think the director of CDC is making that decision.
You think it's a political decision?
Well, I think it's, all I can say is I think it's above the director of CDC because I know he would love to have us a system.
China has accepted help from the World Health Organization. The CDC is waiting to hear whether it's going to be a part of that team. In the meantime, Redfield says his priority is to keep Americans safe.
Our whole issue right now is, as I said, aggressive containment to try to give us more time, but it's going to take, 1 to 2 years to get that probably developed and out, to prepare the health systems to be able to be flexible enough to deal with the potential second major cause of respiratory illness.